Some things have disappeared. Our hopes, dreams, and passion. Seems like all we have now is anxiety and fear. But no matter what happens, no matter how challenging it gets, we'll have to see it through. MedLife Protect Plus, protection from medical bills and life's uncertainties. We know we can never go back, but we'll find our way forward. MedLife Protect Plus. Brave the new world.
The Philippine Daily Inquirer would like to thank the following sponsors for making this live stream event possible. BPI, ready today, ready tomorrow. Converge, experience better. Medicard, prescribed by doctors. Toyota. We'd also like to acknowledge the organizations that have partnered with us. Thank you to. We'd also like to thank Inquirer.net, Mega Mobile, and Inquirer Academy.
Good afternoon, everyone. Thank you for tuning in to the Inquirer Project Rebound webinar series presented by the Philippine Daily Inquirer. My name is Cheche Moral, editor of Inquirer Lifestyle, and with me is Pam Pastor, Inquirer Lifestyle assistant editor, who will be my co-moderator for this live stream event. The Philippine Daily Inquirer and its sister companies introduced Project Rebound in the desire to empower Filipinos amid these difficult times and to do its part in helping our economy bounce back. We've been doing this by sharing insights from experts and success stories that are meant to inspire others to recover and thrive. This is also why we are here today. To know more about Project Rebound, let's watch this video.
The COVID-19 pandemic and the resulting lockdowns have dealt a heavy blow on the economy. Millions of Filipinos were left jobless, thousands of companies were forced to close, and thousands more have had to downsize to ride out the downturn. But all is not lost. Almost a year into the crisis, the Philippines has begun its journey to recovery with stimulus measures and policies in place. Filipino companies, groups, and individuals have also shown their resilience and are slowly regaining their footing. The Philippine Daily Inquirer, along with its sister companies, seeks to do its share to help the Philippines bounce back from this unprecedented crisis by doing what it does best: tell the stories that empower the Filipino. Through Project Rebound, the Philippine Daily Inquirer will share expert insights and inspiring stories of how businesses can accelerate their recovery, how to retool and recalibrate to survive and even thrive amid the COVID 19 pandemic in collaboration with the government, civil society, and the private sector. With its 67 million strong reach across multimedia platforms, the Inquirer Group is indeed in a favorable position to inspire a rebound from the crisis. Together, we can and will overcome.
This afternoon, our topic is Surviving a Pandemic, Assessing Philippine Healthcare Amid a Raging Crisis. Our panel of experts will be talking about how you can deal with the different quarantine classifications, MECQ, ECQ, GCQ. I'm sure I'm not the only one constantly confused by them. How the internet has been playing a bigger role in our lives when it comes to everything from work to businesses and also healthcare. How the pandemic has changed the Filipino mindset when it comes to taking care of themselves physically and mentally, the challenges faced by healthcare providers, and how we can cope with the continuing pandemic. This topic is something that concerns all of us, so I'm sure you'll have questions. Just type them into the comment section and we will ask our guests to answer them for you.
Before we introduce our guest, we would like to give an exclusive offer for our viewers. You can get a free 30-day trial of the Philippine Daily Inquirer's digital edition, Inquirer Plus. We are flashing the details on your screen so you can see how to get this free trial. You can also visit shop.inquirer.com.ph to know more about Inquirer. Now it's time to introduce our guest for today's session. Our first speaker is Dr. Annalisa C. Ong Lim. Dr. Ong Lim is a professor and attending pediatrician at the University of the Philippines and the Philippine General Hospital. She's a fellow of the Philippine Pediatric Society, where she serves as a member of its board of trustees. She's also the immediate past president of the Pediatric Infectious Disease Society of the Philippines. Dr. Ong Lim received her MD from the University of the Philippines. She completed her residency in pediatrics and post-residency fellowship in pediatric infectious disease at UPPGH, where she is now chief of the Division of Infectious and Tropical Disease. As part of the Philippines COVID-19 response effort, Dr. Ong Lim serves as a member of the DOH Technical Advisory Group, the IATF Technical Working Group on COVID-19 variants, as well as the Interim National Immunization Technical Advisory Group for COVID-19 vaccines. Good afternoon, Doc Anna.
Doc Anna, you're on mute.
I'm so sorry about that.
It's okay. It
Thank
happens
you.
every session.
Yeah, right. Thanks, Che, for the introduction. Hi, Pam, and hi, everybody. And thanks for inviting me. I'm sure this will be a very interesting discussion.
Thank you so much, Doc Anna. Very excited to hear from you. Our next speaker is Benjamin B. Azada. Benjamin is the Chief Strategy Officer of Converge ICT Solutions Incorporated. He leads the team in identifying, developing, and executing key strategic initiatives to drive corporate performance. Prior to joining Converge, Mr. Azada was a consulting managing principal and a management board member of PwC Philippines and a partner of PwC's Southeast Asia consulting practice. Good afternoon, Benj.
Good afternoon, Cheche, Pam, and my fellow panelists. Really happy to be part of this discussion. We're eager to share how fiber broadband is key to strengthening the delivery of healthcare.
Thank you, Benjamin. Our third speaker is Dr. Joanna Javi Herrera. Dr. Herrera is a licensed psychologist in the Philippines and in California. She obtained her master's and doctoral degrees in clinical psychology from the Wright Institute in Berkeley, California. She completed pre-doctoral and fellowship training at the Children's Hospital and Research Center in Oakland. Prior to returning to the Philippines, she was a director of a community mental health program in San Francisco Bay Area. She holds private practice as a clinical psychologist, provides services and consultation to organizations, and is involved in the training and supervision of psychologists. She is president and co-founder of We Thrive Consultancy and Wellbeing Services Incorporated, and executive director and co-founder of Circle of Hope. Good afternoon, Doc Javi.
Good afternoon, everyone. This is a wonderful effort by the Inquirer, and I'm really happy to be here. Thank you.
Thanks so much, Doc. And our final speaker is Leo Tan. Mr. Leo Tan is the Chief Marketing Officer of AIA Philippines. He is responsible for the AIA Philippines Group's marketing strategy and initiatives, brand and product positioning, marketing communications, conceptualization, and delivery of the customer experience strategy, as well as the AIA Vitality Customer Engagement Platform. Prior to his appointment, Mr. Tan was in charge of agency sales distribution for the Greater Metro Manila Zone as AIA Philippines Zone Head. He rejoined AIA Philippines after having served as Chief Marketing Officer for Generali Philippines BDO Life from 2013 to 2016. Good afternoon, Leo.
Hi, Pam. Hi, Che. Good afternoon to everyone. It's a pleasure to be part of the panel. I hope that I'll be able to share insights also on how the insurance industry has helped the country in coping up with this crisis. So looking forward to our discussion.
Thank you, Leo. Okay, now let's begin our discussion. The first question is for Doc Anna and Doc Sabi. This sounds simple enough, but what's the best way for ordinary citizens to deal with the changing rules in the pandemic situation? Yeah, we all know that it's good for our health, mental or otherwise, to keep some semblance of normal routine. But how does one do that given the ever-changing quarantine classification?
That's a
Doc
very
Anna, you can
interesting,
go.
that's a very interesting question. And I think it really addresses the root of the anxiety and frustration that people feel, no? Parang hindi mo malaman from one minute to the next kung ano na yung kailangan mong harapin. So let me just take the health lens and try to answer it from that perspective. I think kahit ano pa man yung mangyari dun sa quarantine classification, the key thing that people have to keep in mind is our purpose is to avoid being infected and avoid bringing this infection home. And that will not change regardless of the quarantine classification that we have in the community. No? If we keep in mind that every person we meet who's outside our bubble is potentially infected, then we automatically assume the protective behaviors that should already be part of our lifestyle now. And regardless of the community quarantine classification, if we protect ourselves, being the working members of the household, then we should be able to keep our families safe. And that's really the paramount consideration.
Doc Sabi?
Yeah, from a mental health lens, stress and anxiety naturally get activated with uncertainty and changes that we cannot control. And we've been experiencing that for such a long time. So I think that the two key things for me here would be structure and strong positive connections. For example, in our families, it's really healthy to have a structure. Structure is regulating for kids, it's regulating for our young people. So in the midst of the uncertainty, we focus on what we can control. We can establish a sense of predictability and order in our homes by having a schedule, having regular times for waking up, for meal times, for family connection, for physical exercise, for sleep. Sleep is a really important restorative activity that we need to structure. We need to take care of that. And then in the midst of uncertainty and feelings of destabilization, strong positive connections are key to stress regulation. It's a really important source of stability to our nervous systems. So positive connections in the workplace and in the family are really important. So regular touch points for connection, team huddles, managers checking in on their employees. These are really vital right now.
This next question is for Benj. Benj, can you talk to us about how the telcos and internet providers help in ensuring the seamless delivery of healthcare? How crucial is their role? How have telcos beefed up their services to meet the demands of the pandemic because everybody is really relying on the internet right now.
Thanks, Pam. Yeah, to Doc Joanna's point, no, strong positive connections are key. So you think about the healthcare ecosystem, right? You have the barangay health stations, rural health units, you have government hospitals, private clinics. Then of course you have the rest of the ecosystem that supports it, right? Like the DOH, PhilHealth, the LGUs, PCSO, and of course private health insurance, right? Like AIA. And then you have the entire supply chain of for pharmaceuticals, medical devices, and supplies. So us as telcos, broadband providers especially, we need to ensure that connectivity among these players and with the patients in the ecosystem is there, no? And this is all the more important now with the pandemic. Of course, COVID-19 has accelerated digital transformation across all industries, including healthcare, of course. And so connectivity is really important to the whole healthcare patient process and to communicate with patients and the institutions. So, for example, an enterprise client of ours is an LGU actually, and they're using our fiber technology to connect all their public health centers within the jurisdiction. So this is quite an important initiative to build, to be able to share health records in a secure fashion and serve as a highway for real-time health emergency response. So this is just an example of how broadband can be used to fulfill public health goals. And then, of course, there's the whole issue of access to primary care through telemedicine. So myself, share a little bit about what happened to me last year. In the midst of ECQ, I got acute back pain, and of course, I didn't want to go to the hospital. So I downloaded hesitantly an app, right, with one of the telemedicine providers, got a consultation, got my medicine prescribed. Had a webcam showing where my back hurt and all that. And then, so without reliable connectivity, I would have never been able to do that. But all of that enabled me to get through that episode. So how have we beefed up our services as Converge? We've been on an aggressive expansion plan since last year, and we've been and our services have already reached Visayas. No, we started in Central Luzon. We're now through almost all of Luzon. We've reached Visayas with a commercial launch in Cebu, and we'll be launching in Mindanao as well before the end of the year. We're going deep in Luzon, meaning we're trying to reach the farthest barangays and puruks to serve their connectivity needs. And so as of the middle of the year, June 30 this year, our network has now reached over 400 cities and municipalities nationwide. In terms of infrastructure, we've also doubled our capacity. So our domestic backbone is now at 800 Gbps to accommodate more customers. We've also improved our customer services as well, improving our answer call rate to 96%. And we've also been doubling our installation and repair teams as well. So that's why we're now able to. Well, at the end of last year, we were able to install 86% of our Metro Manila subscribers within 7 days and 64% within 1 day of application. So all of this upgrades, network rollouts, and improvements is really to help fulfill the demand of Filipinos for reliable connection.
Okay, so the next question is for Leo, who's it's actually connected with what Ben said. We're all doing our businesses online now. Even pre-need health plans are being sold on the web. Please talk about the impact of the pandemic on insurance sales.
Yeah, thanks, Che, for that question. But probably before I talk about the impact on sales, I'd like to articulate also the impact on claims because really, when it comes to insurance, it's really fulfilling the promises that we have made to our customers and policyholders. And just to share, the entire insurance industry last year paid out a total of close to 4 billion pesos, so around 3.89 billion pesos to be exact. And this is spread across HMOs, life insurance organizations, companies rather, mutual benefit associations, and non-life insurers. So even non-life rose to the occasion in helping Filipinos be relieved of financial stress. Ang dami na nga stress on the health, on the mental health, as Doc Javi said. The last thing that we want is, you're recovering, but you're worrying about how to pay for the medical bills on top of what the government will be supporting, right? So this is something I'm very proud to share, not because we paid a lot of claims, but really the insurance industry rising up to the occasion. Because normally when you have pandemics, there are actually some exclusions in the fine prints of these contracts. But what really happened was everyone banded together, along also with the call of the Insurance Commission. Let's help our fellow men. Let's not deny claims. Let's instead accommodate them, whether these are hospitalization claims or sad to say, marami rin yung death claims. Because the last thing we want also is the family is mourning, right? Because of what happened with the lost loved one. And after that, income disruption will also affect how the family will cope up. So BPI Philam, which is a joint venture of BPI and AIA, along with AIA Philippines, made sure that for all the products that we have, whether it's for medical coverages or life insurance, we accommodated all these COVID-related claims. Sure, I'd also like to share that it's not just all about business, because we do have our CSR programs. We've actually extended coverages also for free to medical frontliners. I don't know if Doc Ana and Doc Javi are aware of this. So we said during the height of the pandemic, while we were extending coverages to our customers, we said, what about the frontliners? Because they're the unsung heroes. They're the ones really taking care of those who are sick. And that time, limited data, limited experience people were actually scrambling on how to go about it, right? So we came out with Project First. And when we say extending coverage to medical frontliners, not just the doctors and nurses, even the admin staff who are working in the clinics and hospitals. So we've also participated in the government's drive to procure vaccines. So we've donated a couple of doses. It's really our way of making sure we relieve those who are victims of COVID and the families of the financial stress, and also making sure that we help in the government's plight for herd immunity whenever that will come. No? Now going back to your question, Che, we have turned bionic when we talk about how the business model has evolved. For those of you who know Lee Majors, the $6 million man, those who are smiling, probably you are dating yourself. So it's really now about how to reach the different customer segments, because the Gen Y and the Gen Z, they're comfortable doing everything online. So e-commerce, Che, you mentioned about prepaid health cards. Yes, that's happening now. But there are also the Gen Xers and the Boomers. I belong to that generation, who would still want to have, I would say, a bionic advisor. So we do have platforms that allow us to talk to our prospects and customers O2O, online to offline, or straight online. So Benj was mentioning about the importance of connectivity. And, we operate not just in NCR, but across the nation. And for NCR, I would say it's a little bit better. But for the far-flung areas, that's where the challenges lie. But not just in sales, it's also important that even the servicing and the claims, like I said, the journey is not just about learning about insurance value propositions and buying from the different providers. It's making sure that if I need to ask about certain features of my policy, if I need to file a claim, we have to do that digitally now. In fact, I rarely see someone queuing in our service centers to do that. Everything has to be online. Everything has to be in our digital portal. So the service of learning, buying, servicing, and claims, that also has transformed. In fact, Benj, I'm sure you've heard of this so many times. No? It was not the CEO or the CTO who accelerated technology and digitalization of businesses. It's actually COVID-19.
Tama.
But it's really a matter of evolving. It's really a matter of evolving and making sure we adapt to the new normal as fast as we can.
Thanks so much for that, Leo. We see people tuning in from everywhere, and we're very happy to see that. We have Yoli in Cavite, Annette in Los Angeles, Sunny in Banawe, Eduardo from Parañaque. Guys, if you have questions for our experts, please send them in. We're gonna ask them in a bit. But now my next question is for everyone. You mentioned, Leo, the different generations, right? Do you see evidence of Filipinos changing their priorities when it comes to spending and finances because of the pandemic? Has that changed the Filipino mindset? Is there a growing recognition of the importance of health protection? This is for everyone, but let's start with Leo.
Yeah, thanks, Pam. Very interesting question. Regardless of the generation that you belong in, I think people now have a heightened awareness to have protection as part of their plans. Why? Because the what ifs before that we normally do not want to think about. Diba, bahala na, hindi naman mangyayari yan eh. COVID really made us realize that the unexpected can happen and the impact on the lifestyle and the finances. This is actually a health crisis that turned into an economic crisis. Unemployment rates, depending on the community quarantine protocols. I think Doc Anna mentioned that, no? ECQ, MECQ, GCQ. But there are industries that are affected more than others. So what we've seen is, yes, people realize that we need to have emergency savings set aside just in case, restrictions again are implemented. But more importantly, not just talk about saving and investing, because the what ifs in life, like getting hospitalized, getting critically ill. What we've also seen is that COVID triggers some of the complications of critical illnesses. So some have recovered, but the damage to the other systems, that was the cause of death. So we've also seen the shift. Before, a lot of our customers would want to just talk about saving and investing, which is important. But now they also ask, does this value proposition also have medical benefits? Does this also have critical illness benefits? Kasi na-realize, di ba, that it can really happen. In fact, our business portfolio now is more balanced. Dati, the Gen Ys would just think about saving, YOLO. Di ba? I want to save because I want to have that trip or I want to have that gadget. Now they're now very aware the different types of medical protection, the different types of critical illness protection, and even life protection. So that mindset shift, that pivot, really, really very evident.
Let's go to Doc Anna.
I think people have always recognized the importance of health protection. I think it's really just a question of maybe how high it had been in their list of priorities. And with this health crisis making that need very obvious, then of course, families are planning for this even more now. I think, though, that one of the biggest resources that people have tapped into, particularly with respect to the COVID diagnosis, is PhilHealth. And I have to say that this particular channel through which assistance has been offered has been quite helpful. I have a personal experience with my family where my dad was admitted into the ICU for COVID. And even with the built-in advantages of working in the institution where I'm at and being a healthcare worker, and so the courtesy fees usually apply, all of those other expenses that we had to deal with were substantially covered by PhilHealth. And so whether it's health maintenance organization budget, or maybe insurance, or making sure your PhilHealth coverage is up to date. I think people are really recognizing the need to have some kind of resource available for them to fall back on if in case a problem comes up.
Thanks so much, Doc Anna. Now let's go to Doc Tabby.
Yeah, the pandemic has kind of forced a maturity. There's a forced maturity in our curve towards valuing mental health more. So we see more willingness from individuals and businesses to invest on mental health, but there's still also a lot of hesitation. So we see businesses really interested in mental health, but they're also repatterning in terms of how they allocate resources for mental health and well-being initiatives. It's still not, there's still some hesitation as to how much is going to be allocated, and maybe there's still some questions about how does this help the bottom line. So perhaps as providers, we also need to really carefully monitor our outcomes and have a systematic framework for implementing our programs. It can't just be a piecemeal approach, so that we can show that mental health programs work. But for the most part, we've been working with employees across different sectors. They've really been valuing mental health support so much, and the younger generation of employees are really valuing employees who provide this service.
Yeah, that's really wonderful to see, Doc. Now we go to Benj.
Just a quick comment from me. So with the pandemic and the resulting lockdowns over the past year plus, right? We and other telecoms players kind of became almost the backbone or enabler of the entire economy, because everyone's at home, right? The home has become the workplace, the classroom, entertainment center, marketplace, and clinic, all in one, enabled by broadband. So given that, we've estimated that the average family of 4 to 5 people would need around almost 500 gigabytes of data per month in order to function effectively online, given everything that's happening. So rather than spend money on load for individual mobile phones with limited data, with data caps, right? So what a lot of families are finding, it's more, since you're stuck at home, it's much more economical to spend, on a monthly plan on fixed broadband. And our plan starts at 1,500 pesos. So you have no data cap. The whole family can share that broadband connection, that Wi-Fi connection at home. And so given that calculus and that thinking that, the household heads have thought through, what we're finding is that 95% of our new subscribers that have come in the recent quarter, 95% of them were first-time fixed broadband users. So they have never had a broadband connection at home, a fixed broadband connection at home before, but they're realizing that, hey, now's the time. This is the new normal. We need to do this, and we expect that even after things go to what normal or whatever normal is going to look like in the future, that people have now really changed their behaviors and believe that they need that connectivity at home. They need that reliable, stable connectivity. So of course that spending, that share of wallet is shifting towards fixed broadband.
So there's also added investment for telcos like Converge to meet this demand.
Definitely. Yeah.
Thank you, everyone, for your insights. If you're watching and you have questions, feel free to send them in and we'll ask our panelists to answer them for you. But before we continue with the next part of the program, we will have a quick break, so stay tuned for more.
The Philippine Daily Inquirer would like to thank the following sponsors for making this live stream event possible. BPI, ready today, ready tomorrow. Converge, experience better. Medicard, prescribed by doctors. Toyota. We'd also like to acknowledge the organizations that have partnered with us. Thank you to. We'd also like to thank Inquirer.net, Mega Mobile, and Inquirer Academy.
Imagine a life where mobility opens up roads to countless possibilities, where you and your loved ones experience the thrill and joy of moving together, where you get to enjoy the important things and not worry about the little things. This is life with Toyota. And now, you don't have to imagine. Your access to a new world of mobility has finally arrived. Get ready to elevate your life with a new My Toyota app. Available on Android and iOS, My Toyota now comes with added features to level up your driving experience anytime, anywhere. By signing up with your personal My Toyota account, you're just a few clicks away from a wide range of useful tools. Want access to a Toyota showroom no matter where you are? With a virtual showroom, you can now explore Toyota's lineup on the go. You can even build your Toyota and find your perfect match. Book a service for your car's regular maintenance with so much ease and time saved. Or check your repair status right on your device. Do it in just a few taps. Adding accessories to your car? Simply add to cart with us to make sure you're getting the right one. See our range of available service packages and take your picks right away. You can even renew your insurance quickly for that added peace of mind. Want to trade in your car? You can inquire at your nearest dealer. You can even check listings of Toyota's certified used vehicles. Get in touch with your nearest Toyota dealership in just a few clicks. Encountered a problem on the way? Access our roadside emergency assistant and be connected with your service providers. Make payments easier by choosing from available payment options and soon experience greater payment convenience with My Toyota Wallet. Stay on top of the latest promos, announcements, and other important reminders. Do all these and more with Toyota's one app for all the things you need to make car ownership and maintenance more convenient, easier, and more fulfilling. The new My Toyota app. Life with Toyota made happier in a tap. Download My Toyota app today. For more information, visit www.toyota.com.ph/mytoyota.
I want to be like Mama when I grow up. Mama says learning can take us from where we are to where we can be. It can change us from who we are to who we can be. That in teaching minds, we also end up teaching hearts. Thank you for taking care of Mama Mina so that she can inspire more people to do more.
Welcome back, everyone. Thank you once again for tuning in to the Inquirer Project Rebound webinar series presented by the Philippine Daily Inquirer. We have more questions waiting to be answered. Pam will start off with this one.
Okay. Let's go to Benj. What you mentioned about the amount of first-time broadband users signing up is fascinating, and it makes sense because, like Doc Jabi mentioned, it's so important right now to have that positive support system, and most of us rely on the internet to connect with those people. Like, to me, it feels like the internet is my lifeline and it's my line to the outside world. So can you talk about the innovations that have been introduced in your company to allow better delivery of healthcare services?
So thanks for that question. Our main value proposition as Converge really is around connectivity. So that's connectivity based either access to the internet or connectivity among different sites. For example, for businesses, let's say you're a hospital network and you need to connect your different hospitals, your different sites together. We also have private network solutions to connect health facilities. No, so these are the kinds of products we we offer. And recently, for example, with a lot of teleconsultation starting, right? Of course, that teleconsultation is not going to happen 24/7. So you don't necessarily need the same bandwidth 24 hours a day, right? So that's why we have a time of day plan, for example, both for direct internet access or even for small and medium enterprises, which would be perfect for clinics, for example, right? So while during clinic hours or during hospital operating hours, you have more bandwidth, and then during the time when you don't, let's say at night, then we go, it reverts back to a normal set. So that way, you're not paying for bandwidth that you don't need. So I think that's quite important, especially since, to the point a while ago, the question a while ago as to, whether there's a need to tighten belts or reallocate spend. We decided that, it's important to give both our enterprise customers, right, like hospitals and clinics, and our residential customers options that enable them to maximize their resources and also get the best value out of for their money. Also, for maybe some hospitals, as you go digital, right, you're going to need to host some of your data or your applications, and you might not want to have it all on your in-house servers, right? So we also offer a hosting facility, right, for hospitals or facilities that don't want to put it in the cloud, right, for one reason or another. They want to keep it make sure it's in a physical server in a physical location within the Philippines. Then that's an option that we have, and we have I guess a health insurance institution that is one of our clients. So that's an example of the innovation. Oh, by the way, that time of day is also available to residential, so to patients. So they also have that option. So doctors who are doing teleconsultation at home, they can choose that kind of a plan.
That's cool. Thank you.
This is for Doc Anna and Doc Zabi. Have there been major changes in healthcare provision because of the pandemic? And are these changes sufficient? Which areas do you think need the most attention?
Can I start, Jabi?
Go ahead, Doc Anna.
So I think Benj mentioned earlier that he had this experience where the entire health encounter was really done through telemedicine. And this is something that's very new to the Philippine setting. Although we did practice telemedicine to some extent before, using, for example, SMS or telephone-based consults, but these were rather informal discussions with patients for who we would give access to because of a long-standing relationship, or perhaps there are relatives and so on. But now these encounters are happening even for patients we're seeing for the first time and within a more structured setting, and without an expectation perhaps that there will even be a face-to-face encounter sometime down the line, because there are people who have transformed their practice to purely telemedicine just because of concerns with COVID. So this is something that healthcare providers are grappling with. We in the training institutions have had to turn around and figure out how we can teach the basics of medicine using telemedicine so that we produce competent practitioners and clinicians who are already very seasoned in practice, have had to figure out how to change their approach to suit the demands of telemedicine and work within the limitations and transcend these limitations. So of course, it won't be the same, but at the very least, for those needing urgent care and for those for whom their conditions can really be managed online, then this is at least a way for us to make sure patients receive the care that they need.
Sabi?
Yeah, just to echo what Dr. Anna shared, there was also like a big switch for us to telehealth. So we're largely providing telemental health services right now. Most mental health services are provided online and via phone, and by and large, we found it quite effective, really. Sans traffic, right? So I think that mental health is here to stay because it also allows us to serve, it allows us to serve clients from different parts of the country where access is short, right? But the problem in mental health right now that we really need to address is, we have a ratio of less than one mental health worker per 100,000 Filipinos. So we're really very short on mental health professionals. So that's a gap we need to fill. And most of these services are paid out of pocket. So public health budget and mental health is very small. It's 2.65% of the total health budget, and most of it goes to mental hospital. So not even outpatient mental health services. So that's something we need to address. The good news, what's working well, is that business organizations are beginning to see the importance of employee mental health and well-being to organizational resilience. So so that's helping a lot, and we need to intensify and promote these efforts for the long haul beyond the pandemic, because human well-being is really going to be foundational for our recovery and rebuilding as a society.
Thanks so much for that, Dr. Abby. Now we're going to ask a question that's from one of our organization partners. This one is from the Philippine Disaster Resilience Foundation, and it's for Leo. What have been the shifts in consumer behavior with regards to insurance? Are they more or less willing to invest in it given the uncertain times?
Yeah, again, another interesting question. Prior to the pandemic, the favorite product normally of our customers would be savings. We always talk about beating the inflation, what are the year-to-date returns, what's the performance versus benchmark versus peers. And I said, that's okay because people now are more knowledgeable. Okay, although the financial literacy rate of our country is still a little low at below 20%. So people are starting to learn because of again, internet. Thanks, Benjamin, for that. A lot of the Gen Ys and Gen Zs start learning online. But when COVID-19 struck, really there's heightened awareness for insurance, for protection products. I call that protecting Filipinos from the 4Ds. Disease, disability, disgracia, and the other D word that we don't want to hear, but I'll say it anyway, death, untimely death. But what's interesting now is that while things have moved to the digital space, our customers actually are more demanding. Because you know how insurance works. If someone gets diagnosed, if someone passes away, then we pay a lump sum amount and we pray and hope that they will recover, right? We're actually not part of the health journey. So we said we should take it up a bit, a level higher. Instead of just becoming a payer, we should also be a partner. We should also be a partner. What am I talking about? Can we be a partner in their total health, end-to-end health and wellness journey, from prevention to prediction, protection, diagnosis, treatment, and all the way to recovery? So as life insurance providers, nothing's stopping us from augmenting our value propositions, talk to institutions that would be able to enhance these services. So Doc Jabi was talking about mental health, right? That's also part of prevention and even probably all the way to diagnosis, treatment, and recovery. I'm a COVID-19 survivor, although mild symptoms lang naman. Back aches, loss of sense of taste and smell. But the thing that really caught me was the mental stress, the anxiety. Have I infected my wife and my 4-year-old son? What will happen if my symptoms complicates or get worse? I even wrote my last will and testament during my quarantine period. So these things are serious. It may sound funny, but providing these services, making them accessible to the everyday ordinary Juan de la Cruz or Juana de la Cruz, that's very important. So I think aside from enhancing our product benefits, that part of the value proposition, the augmented services, that entire ecosystem, that's something that I'm seeing a lot of insurance providers are working on, and we're going to see more of that as the years come along.
Happy to know of your recovery, Leo. Now
Thank
we
you.
go back to our two doctors. Given the challenges faced by PhilHealth and its depleted funds, do private healthcare providers have the capacity to step in and provide adequate services to customers, and at what cost? Doc Anna, do you want to go first?
Mahirap sagutin, no, yung tanong. And parang ang perspective ko kasi, siguro sa atin sa Pilipinas, sanay tayo sa stretching our limits. Sanay tayo to make do, no? And I think that's also the perspective that's informing a lot of how we perform and provide our services. Hanggat kaya, kakayanin. So lalo na siguro we're in the context that everybody understands that resources are very limited, the demands are significant, and ang approach or ang perspective has been, sige, let's try our best to provide whatever services can be given. But then, of course, we have to recognize that there's a limit to that. And one of the things we have to understand also is there's a limit to how safely we can provide care if resources are stretched. And sana naman, no, kung ma-recognize yun, then yung available pa na resources na pwedeng dalhin sa healthcare can be utilized, no, para madagdagan naman yung pwede nating pakinabangan. No, lahat tayo pwedeng makinabang dun sa mga resources na yun.
Doc Anna, Doc Javi, anything to add?
Yeah. Well, in mental health, what we've seen is that there are healthcare insurance companies that have started to provide mental health services to subscribers, and I really think it's a step in the right direction. Of course, we want more qualified mental health professionals. My wish is, and shout out to like this is it's good that Leo is here. We need, I think, greater parity for mental health conditions, so that these services can be made available to more people, because currently mental health care is mostly paid, again, for by out of pocket, by service users. And when we address mental health problems, we can also prevent the occurrence and escalation of diseases. I think we've seen the interweaving of that so clearly. So it's really worth investing in these prevention and early intervention when it comes to mental health. We also need to invest in community-wide prevention efforts. So, primary care settings, settings where people live their lives every day, workplaces and schools, integrating mental health programs into community settings such as these are really important. And prevention programs are not really a costly investment. So psychoeducation and mental hygiene, on stress regulation, focusing on micro practice, like the small actionable steps that are, that can really help rewire and put us in a path of resilience. That it's not expensive to invest in these programs.
Thank you so much for saying that, Doc Jabi, as somebody who's super passionate about mental health. I think it's really, really important to stress that. Now I have a question that's from our Facebook. If you were in charge, I'm gonna ask this to our two doctors, but if Benj and Leo want to also chime in, feel free. If you were in charge of the country's response to the pandemic, what would your top 3 recommendations be? In or out? Contact tracing sheets in stores, face shield, checkpoints. Do you recommend those things? And if not, what would you recommend?
Pwede bang hindi pumili dun sa tatlo?
Well, you can make your own recommendations.
Kasi I think no, yung priority, actually I can distill it into two. We need human health resource investment. Yung ibang components ng ating health response, hindi natin pwedeng sabihin madaling gawa ng paraan pero may paraan. Pero yung human health resource has been a challenge ever since we started. Gustuhin mo mang magdagdag ng capacity, kung wala kang tao, walang mangyayari. And the other thing that might not be top of mind as a health intervention, but really underpins the entire response is digital technology. Parang imagine how efficient we could have been kung available yung resource na yun and nagamit natin ng tama. Marami siguro tayong naiwasan, marami siguro tayong nagawa ng mas mabilis pa. And I think this really highlights the need for technology to become integrated into healthcare moving forward. Hindi na pwedeng hindi acceptable na hindi siya kaparte ng healthcare infrastructure.
Thanks so much for that, Doc Anna. True, I agree. And I hope we learn from it na hindi pag kunyari natapos yung pandemic, we forget about it. Like, next we go to Doc Jabi. What would your recommendations be?
Yeah, I mean, for me, it's a healthy mindset, and that healthy mindset is defined by really embracing the greater good. What this pandemic, the nature of this pandemic as an infectious disease, is that it can't be an individual concern. Infectious disease is something that we need to deal with as a community, as shared humanity. So for me, it's a very strong public education message that really inspires us to embrace the greater good. That every choice we make, every decision we make has to really take interdependence into consideration. I feel like that's what's going to see us through, that sense of interdependence and really caring for one another.
Thank you so much for that. Leo, Benj, do you want to say anything?
I think they covered it well already. Thank you.
We're
Thank
not
you.
medical experts, but I think I'll resonate what Doc Jabi said. It's not just about yourself or your family, it's the entire community. So what you do, what your behavior is, how you react, how responsible or disciplined you are will affect how the country and the world will be able to achieve the so-called herd immunity, right? So again, I'm not an expert on that, but just my personal opinion.
Thank you, Leo.
Benj, anything to add?
No, I think they've covered it well. I think
Okay.
I think we need a whole of government, whole of country response, really. So yeah, and yeah, I'll leave my comment at that.
And this is our last question for all of you. Are your organizations revisiting your business models or at least the way you do things, given the threat of climate change? As we anticipate more disasters, natural or otherwise, how are your organizations preparing to respond? Because they're saying this is not just the pandemic that we can expect. That's as scary as it sounds. Let's start with Leo.
Yeah, thanks, Che. What's funny is before COVID-19, I recall there was Taal, right? It was January of 2020. So they say that COVID-19 is a black swan event, pero parang ang daming black swans na sa mundo no? But that's a good question. In fact, for life insurance companies where we try to manage risk, right? It's either you embrace these things, exclude them from your contracts, or be a solution, right? And include them in your benefits. So I'll give you a good example. Before, life insurance companies would exclude acts of nature, but now there are products from BPI Film, of course, and AIA Philippines where we do cover them. In fact, we even double the coverage in case of accidents caused by acts of nature. So it's really trying to work on these and make sure that you'll be able to come up with solutions. But aside from that, I think it's very important that as a company, as an institution, it's not just about the profit and loss statement, right? It's not just about the bottom line. It's also doing well while doing good. So proud to say that BPI Film and AIA Philippines, we have what we call our ESG pillar, environment, social, and governance. So very balanced. It's not just about revenues and profits. What am I talking about? ESG is environment, social, and governance. We have sub pillars there, focusing on uplifting health and wellness in our country. At the same time, operating in a way that we're very green. So green operations. As much as possible, we don't want to leave a big carbon footprint, although it's impossible to zero that out, but at least minimize. And even in the way we do our investments, life insurance companies have a lot of assets that we invest in different instruments for nation building. So we're very particular if that particular investment is associated with a company that invests in coal or other environment damaging has environment damaging impacts. We don't associate ourselves with that. So these things, although it may seem small, but this shows the values of the company. And again, all these minor things, when you add them up, when we have more organizations and companies being more cognizant and conscious, that will go a long way. So our own little act of helping the environment and make sure that we minimize impacts of climate change.
Thanks, Leo. Doc Anna?
Well, I'm part of a lot of organizations, so maybe let me just take one and focus my response to that one. In pediatrics, a lot of our intervention is based on prevention and anticipatory care. And we provide wellness visits. We emphasize immunization as part of our response. And all of that used to hinge on face-to-face visits, as with most of healthcare. So understanding that this will not be the last pandemic, there will be a lot more in terms of challenges, maybe not necessarily directly health related, but will impact on healthcare delivery, should force us to embrace these alternative means of delivering healthcare and adapt to it, and maybe create a hybrid in terms of delivery of services. Nung nagsimula kasi earlier last year, no, at least for the first quarter, when people were still grappling with how we should respond to COVID, all of our well-child visits were suspended. You can imagine that dominoing all the way to 1.5 years down the line. So we have this entire cohort of kids who did not receive preventive healthcare services. Tapos pinag-uusapan natin yung palalabasin na natin sila, pababalikin natin sila sa school. I can imagine the nightmare in case one of them comes down with a vaccine preventable disease and how quickly that can spread in an unvaccinated population. So problema na natin yung COVID, problema pa natin yung BPD. So ang change na kailangan sa mga organizations namin is to learn how to deliver these services within the context and despite the limitations of this COVID or other disasters that might happen.
Okay, thanks, Doc Anna. Ben?
Thanks for that question. By the way, we're a listed company, and earlier this year, we had to write and submit to the SEC our first sustainability report. So like Leo's team, right? We had to start thinking about ESG, environment, social, and governance factors in a more deliberate fashion. Of course, Dennis and Grace, our founders, have always had sustainability at the core of the business and in mind. I mean, they really wanted to start this business to serve the underserved and the unserved in terms of internet broadband. So clearly, we've been expanding at a meteoric pace, but we really are still growing with sustainability in mind and thinking about how we're going to respond to threats like climate change. No, so in our sustainability report, we've actually written there detail there our assessment of how climate change may impact our company. Of course, because it will bring physical risks. So of course, with this climate change, you have stronger, more frequent typhoons, right? And flooding and all of that, right? So that could impact our network infrastructure, our business sites, our data centers. Especially also with warming, right, of the temperature, it could overheat some of our equipment. So all of these are things that we need to protect against and make sure that we have a resilient network. So what have we been doing? On all segments of our network, international, our backbone, and our access network, we have a number of projects to really try and strengthen that and put in redundancy. So we have a diverse international network across different points of presence to Taiwan, Hong Kong, Singapore, US, different cable systems, and we have also just invested in our own cable landing systems as well, right? Our own national backbone is all underground, right? So that it won't the poles won't get toppled over by typhoon, because of course, if our backbone, that's our main network, if that gets damaged, then tens of thousands of subscribers could lose their service. So we put that underground. Then of course, we're also improving our operations and maintenance team so that we have quicker response, right? We're also making sure that we have a loop architecture on our network so that if one side gets cut, the other side, there's still connectivity. So those are the kinds of things. A lot of them are very technical kinds of things that we're doing in order to protect ourselves from climate change and the NatCat, or natural disaster risk that it will bring in the future. We've also beefed up our business continuity management, and we're continuing to test and improve that. We've also beefed up the team that does that, so that we bring in more kind of a professional approach to disaster recovery and business continuity. So this is also, we're putting this into practice both for ourselves, but also working with our major customers and also our suppliers as well to prepare for these kinds of untoward events. And of course, also in the communities that we serve, we also recognize that natural disasters can also have an impact on the communities, which is why we do things like, we've provided connectivity to evacuation centers in Batangas near Taal, right? Also, the vaccination centers in Angeles and San Juan, we've also provided connectivity for that. Because, of course, if you want to do good record keeping, there needs to be connectivity so that you can maintain those electronic records, and also provide connectivity to people who happen to be in those centers. So those are the kinds of things we're doing, and as we move forward with our business, we'll be really committed to sustainability, especially the Sustainable Development Goals of the UN, which the Philippines has signed up to. And I think all private sector players also have a part and a responsibility in helping the country reach those SDG targets.
Thank you so much, Benj. Now let's hear from Doc Jabi.
Yeah, Pam, we see the imbalance that has resulted to climate change as coming from an imbalance in the human psyche. I mean, we're the ones engineering this, right? So, our reluctance to slow down, our addiction to more, to bigger, faster, so our business model is really to respect the human nervous system on an individual and collective level, because we have a collective nervous system as families, as communities, as organizations, to respect the human nervous system as a micro earth. So it means being able to really listen to our nervous systems closely, befriend it, shape it in a way that allows it to recover and to be well. So for us, it's really the integrity of practicing what we teach our clients, both at an individual and organizational level. Our priority has been on people care, and we've been really standing alongside our partner organizations to help managers and leaders listen to the collective nervous system of their organizations, allowing well-being to stand alongside their goals, their productivity goals, and not leaving it behind. So, as a company, we're quite literally breathing together, and we're teaching groups, teams, organizations literally to breathe together, to be one united, cohesive nervous system that's taking care of one another, because we are an interlocking nervous system. There's really no individual here. So teaching self-care as community care, so internalizing that we need to operate as a whole. I think I don't know, I think it was Bench who mentioned it earlier, but holism, I guess, has been our motto.
Thanks so much for that talk, Jabi. That thing that you said about thinking about ourselves as a micro Earth is gonna stick with me. I'm gonna be thinking about that today. Before we go to Leo, I just want to ask Doc Anna a quick question. Just because you mentioned the unvaccinated kids kanina, I wanted to ask you, what would you like to tell? Baka somebody's watching and they're still hesitant to get vaccinated kahit available na in their barangay. What do you want to tell people who are still a little scared but are, almost there?
Well, I'd like to encourage people to be vaccinated, no, of course, because this is really one of the most effective ways by which we can avoid getting severe or critical disease and lower our risk of death. And this is the game changer that people are talking about with respect to being protected from the impact of COVID. Pwede pa rin tayong mahawa, pwede pa rin tayong manghawa, pero at least yung kaba, no, that Leo expressed, gumawa siya ng last will and testament, ilang taon na ba itong mamang to? Bata ka pa, di ba? It's not something that you think about. But hindi natin maiwasan na pumasok sa isip natin yan pagka mahawaan tayo ng COVID. Walang guarantee na hindi tayo madidisgrasya. And don't we want to be able to take every advantage kung nandiyan na, di ba? So I hope people take this opportunity. Wag sayangin yung pagkakataon.
Thanks so much, Doc.
Thanks, Doc Anna. We could go on, but that's all the time we have for this Inquirer Project Rebound webinar. Once again, thank you so much to our speakers for sharing their valuable insights with us. And we will be ending this online discussion with a closing message from our speakers. Let's start off with Doc Anna.
Thank you once again for having me and for giving me the opportunity to share the message I'm always sharing, no, with various audiences. Itong topic natin about rebound implies resilience, and siguro yung isang problema natin is our sense of powerlessness. Parang nadadala na lang tayo sa agos, wala tayong magawa, and yet wag nating maliitin yung proteksyon na binibigay sa atin ng pagsunod sa minimum public health standards. Alam nyo, natapos yung 1.5 taon halos until March of 2021 na wala namang ginamit ang mga healthcare workers, kundi yung tamang paggamit lamang ng face mask, face shield, physical distancing when possible, making sure the ventilation is controlled, and trying to minimize our time of interaction. At karamihan ng mga healthcare workers nakalampas no, dun sa pagkakahawa just by using these very basic protective interventions. Now, nung dumating na yung bakuna, lalong nadagdagan yung pwede nating pakinabangan. And kung ang healthcare workers na kinabang dito, karamihan sa amin, nandito pa naman, awa ng Diyos, lalo pa siguro ang general public na siguro naman mas marami kaming exposure kaysa sa iba. No? So I hope na with that, no, feeling that we can protect ourselves and protect our families just by following these very simple rules will help us manage our anxiety, our frustration, add to our resilience, and help us all move forward. Thank you.
Thank you, Doc. Now let's hear from Ben.
Hi, thank you PDI Project Rebound for this opportunity to share how Converge has been supporting the country through the pandemic. No, we've seen our healthcare partners, our customers, really maximize their fiber broadband connection in delivering patient care. But we hope that the whole healthcare ecosystem, that broader ecosystem that we're talking about, can take lessons from this pandemic and think about next time something like this happens. whether it's a natural disaster or another pandemic. We're just trying to improve the service delivery, patient care delivery for the 21st century. To really think about how we can further digitalize healthcare. I mean, our delivery of care can be much better coordinated through the use of technology. We should be able to give our patients the information they need at their fingertips, right? When they want, how they want it. Even just simple things like, ba't ang haba ng pila sa hospital minsan, right? Using digital technology, can we, improve queuing and scheduling and resource allocation? Can we track, the kind of the equipment in the hospital better? Can we track, so that we can maximize the utilization of these assets, no? How can we better really enable telemedicine, not just for the elite hospitals, but all hospitals, primary, tertiary hospitals and clinics, right? It should not be something that's just limited to the urban areas and to the wealthy, and basic things like eliminating paper patient records, digitalizing them, ensuring portability whilst managing data privacy and security, and also of course, and finally, diagnostics. There's a huge opportunity to improve on diagnostics through the use of digital technologies like AI, right? I mean, in other countries, um, using first pass radiology, reading this diagnosis that can all be done first pass by a computer. But of course, you still need a doctor to sign off on that, right? But these kinds of things can really improve healthcare in the long run. But the underlying all of that, you will need that digital infrastructure, that digital connectivity to make that all happen. Thank you.
Thank you so much, Benj. Now let's go to Doc Jabi.
Yeah, for me, I mean, in support of what Dr. Anna mentioned a while ago, like these basic healthcare practices, that will keep us safe. We need to act together really as one human family. So our safety and survival necessitates community action. There's no way around it. So really making choices for the greater good. So I read into this pandemic as an evolutionary opportunity to mature as a society towards thinking about others, thinking about the whole. It's really about putting greater good into action. So for me, there's no other way. The way forward is together. The only path forward is together.
Thank you for that, Dr. Abby. And now let's hear from Leo.
Thank you, Che, and thank you to PDI for inviting BPI Film and AIA Philippines to be part of the panel. I hope I was able to share some insights on how life insurance can help also alleviate some of the financial stresses of Filipinos. I guess my closing message is we have to be positive to be negative. Positive in terms of mindset, mental health. So Doc Jabi, I think after this session, we will be talking a lot more. And really, we have to work together to achieve herd immunity. I'm not a medical expert, but I know that the virus will continue to mutate. Looks like all the sororities and fraternities, yung mga letters na ubus na no? Because of Lambda, Kappa, Delta. I recall all those fraternity names. But kidding aside, taking the 4 letters of herd, which is HERD, we need to help each other, encourage each Filipino to be responsible and to be disciplined. That way, I'm very, very sure if we work together, we will achieve a better normal.
Thank you, Leo. Thank you again to our panel for this afternoon. That has been quite an interesting discussion. We hope those of you who listened in, like me and Pam, learned a thing or two.
And that's it for our webinar today. Thank you again to our panelists for sharing their time and insights with us. We did learn so much from you. And thank you once again for being part of the Inquirer Project Rebound webinar series presented by the Philippine Daily Inquirer.
Thank you so much to our viewers. We'd also like to thank Inquirer.net, Mega Mobile, and Inquirer Academy. Continue reading the Philippine Daily Inquirer for authoritative news and features. Once again, I am Setcha Moral of Inquirer Lifestyle.
And I'm Pam Pastor from Inquirer Lifestyle. Thank you for joining us and enjoy the rest of the day.
The Philippine Daily Inquirer would like to thank the following sponsors for making this live stream event possible. BPI, ready today, ready tomorrow. Converge, experience better. Medicard, prescribed by doctors. Toyota. We'd also like to acknowledge the organizations that have partnered with us. Thank you to. We'd also like to thank Inquirer.net, Mega Mobile, and Inquirer Academy.
Imagine a life where mobility opens up roads to countless possibilities, where you and your loved ones experience the thrill and joy of moving together, where you get to enjoy the important things and not worry about the little things. This is life with Toyota. And now, you don't have to imagine. Your access to a new world of mobility has finally arrived. Get ready to elevate your life with the new My Toyota app. Available on Android and iOS, My Toyota now comes with added features to level up your driving experience anytime, anywhere. By signing up with your personal My Toyota account, you're just a few clicks away from a wide range of useful tools. Want access to a Toyota showroom no matter where you are? With a virtual showroom, you can now explore Toyota's lineup on the go. You can even build your Toyota and find your perfect match. Book a service for your car's regular maintenance with so much ease and time saved. Or check your repair status right on your device. Do it in just a few taps. Adding accessories to your car? Simply add to cart with us to make sure you're getting the right one. See our range of available service packages and take your picks right away. You can even renew your insurance quickly for that added peace of mind. Want to trade in your car? You can inquire at your nearest dealer. You can even check listings of Toyota's certified used vehicles. Get in touch with your nearest Toyota dealership in just a few clicks. Encountered a problem on the way? Access our roadside emergency assistant and be connected with your service providers. Make payments easier by choosing from available payment options, and soon experience greater payment convenience with My Toyota Wallet. Stay on top of the latest promos, announcements, and other important reminders. Do all these and more with Toyota's one app for all the things you need to make car ownership and maintenance more convenient, easier, and more fulfilling. The new My Toyota app. Life with Toyota made happier in a tap. Download My Toyota app today. For more information, visit www.toyota.com.ph/mytoyota.
I want to be like Mama when I grow up. Mama says learning can take us from where we are to where we can be. It can change us from who we are to who we can be. That in teaching minds, we also end up teaching hearts. Thank you for taking care of Mama Mina so that she can inspire more people to do more.
Bawas ipon ulit.
Ingat kayo dyan. Meeting lang, nak.
Some things have disappeared. Our hopes, dreams, and passion. Seems like all we have now is anxiety and fear. But no matter what happens, no matter how challenging it gets, we'll have to see it through. MedLife Protect Plus. Protection from medical bills and life's uncertainties. We know we can never go back, but we'll find a way forward. MedLife Protect Plus. Brave the new world.